Good afternoon, everybody, and welcome to this Guide to Medicare webinar, presented to you by Excellus BlueCross BlueShield. My name is Susan Kennedy, and I'll be your moderator today. And today we're going to focus on Medicare Advantage and the annual election period, AEP. We're going to discuss why it's so important for all of us to check into our Medicare coverage each and every year. And of course, we're going to just review some of the Medicare basics because we all need that review every year. Doesn't it seem that way? Now, you might be watching this webinar on behalf of yourself or maybe a loved one who you're trying to look at into some further coverage options. And there's a lot of information to get through. So that's why we've invited 3 Medicare experts to help us sift through it all and help us understand. Let me introduce them to you now. First off, we have Tim Shadle. He's a regional Medicare consultant with Excellus BlueCross BlueShield. Tim, your job at Excellus is to assist people with their Medicare choice to find out what's best for them, and we really thank you for your expertise today. Dan Goetzmann joins us as well. He's president of Goetzmann Associates, LLC, a private firm specializing in insurance benefits. Now, Dan, you work with companies and their employees to assess whether it's even appropriate for employees to stick with the company insurance that they have or to get into Medicare. And we thank you so much for your participation today, Dan. Finally, Taylor Frawley. Taylor joins us as an aging specialist with Onondaga County Adult and Long-Term Care Services. Taylor oversees the Medicare counseling program for the county, among other advocacy programs for seniors. And we're honored to have you, Taylor, and Dan, and Tim joining us today. Now, a few housekeeping things for us before we get into the good questions and the heart of the conversation. We are recording this so you can refer to it as reference. It will be sent out in a thank you email and then be posted on the Excellus BlueCross BlueShield website. You'll also find the recording on the Syracuse.com website in the coming days. Your questions, of course, always add to this conversation. So throughout the panel discussion, we have an Excellus rep, Ryan, who will be answering your questions. So put them into the Q&A button and put your questions in there. Throughout the 45 minutes to an hour, Ryan will answer as we go along, which is wonderful. In addition, at the end of the main discussion, after we've talked to our panelists, we will hold a few questions that seem to be really appealing to the whole audience, and we'll have our panelists answer those questions. So, all righty, there's the housekeeping, here's the panelists, and we are ready to go. Thank you so much for joining us. First question right to you, Taylor. Before we get into the meat of this conversation, I need the refresher every time it seems, and maybe our audience does too. For some clarity, what is Medicare? Taylor?
Thanks, Susan, and hello, everyone. Thanks for tuning in with us today. Medicare is the federal health insurance program for individuals who are over the age of 65, just turning 65, or individuals under the age of 65 who are living with end-stage renal disease or ALS. With Medicare, there's a couple of different parts. The first that we talk about is Medicare Part A. Medicare Part A is your inpatient, it's your hospital coverage. So skilled nursing facility, hospice care, home health services following a hospital stay. So Part A, everything inpatient. Medicare Part B is everything outpatient. So it's your doctor's appointments, your preventative services, it's your overall medical coverage. So when you go to your primary care physician and really any of those doctor's appointments or preventative services. Then we have our Medicare Part D, which is your prescription drug coverage. You can get prescription coverage through your standalone Part D plan with original Medicare or Part C. Part C is also known as Medicare Advantage plans.
We will get into more detailed descriptions of all of that, right, in the next moments here, Taylor. But first, Tim, so once you've enrolled, you have options in how to get that coverage, the Part A, B, C, D. So Tim, what is the difference between, as Taylor alluded to there, the original Medicare versus the Medicare Advantage? Go a little deeper for us, if you would.
Sure. Thank you, Susan. The way to think about original Medicare is you're going through CMS, Center for Medicare and Medicaid Services. So you're going through the government. So if I only have Part A and Part B, and I go to the doctor, I have a deductible to meet, but after that, the claim gets processed by the government. On the other hand, if I choose a Medicare Advantage plan, the government's actually paying companies like Excellus to handle all of your claims, to provide all of your benefits, to upkeep the network. So if I stick with original Medicare, I really want to get some extra coverage, whether it's a Medicare supplement or a Medicare Advantage. And Medicare Advantage tends to offer quite a few extras, if you will, that go beyond original Medicare.
So Taylor, let's bring you in again on this. So Tim, because I know you just touched the surface there. What you're talking about, you started talking about, Tim, the add-ons. So there's the Medigap and the Medicare Advantage and the Medicare supplement plans. And explain that for us, Taylor, just as the surface as we get started here today.
Yeah, absolutely. And thanks, Tim, for laying the groundwork there. With your Medicare Advantage plans, as Tim mentioned, you have, some additional coverage. On the other hand, you can go the original Medicare route and you can add on a Medigap supplement plan. So with your original Medicare, your red, white, and blue card, you can add on a Medigap supplement plan to help you cover the out-of-pocket costs, co-insurance, co-pays, deductibles, not covered under your original Medicare Part A and B. So it's only for original Medicare Part A and B. It doesn't cover anything towards your prescription drugs. And you can't have a Medicare Advantage plan with that. It doesn't do anything with out-of-pocket costs for prescription drugs. And because it's part of the original federal Medicare, you can use it anywhere in the US that accepts original traditional Medicare. So then you'll have your red, white, and blue card, and then a separate Medigap card through whatever company that you decide to go through. There's 10 different Medigap plans, another addition to what we call the alphabet soup, but it's nothing you need to navigate on your own. Each of us are here for information about those options as well as we go through the presentation too.
Okay, great. Thank you, Taylor. So now we're going to bring in you, Dan. How do you know if your doctor is in the plan? I know, but there's so much, we can go so deep, but a lot of people just want to know, I love my doctor. How do I know they're in the plan?
Well, you can ask your doctor, but that's probably not the best way. Every carrier has multiple networks, and the doctors don't necessarily participate with every plan that each carrier offers. Every insurance carrier, as well as Medicare, provide access to the participating providers online. Going online is a key tool. If you're uncomfortable going online, that's where you try to seek the services of someone such as Tim or Taylor. As an example, I did go on Excellus BlueCross. I'll use them since they're our sponsor. Excellus BlueCross BCBS.com. I sign on. I select Medicare member at the top. I select member resources. I select find a doctor, and I'm a guest. I'm not on Medicare, but I can go down, scroll down, find the Medicare Blue PPO network, and then just type in my zip code. And there are over 300 general practice doctors within 25 miles of the city. It's fairly easy to do. And new this year, we're getting a lot of questions about dentists. So I check the dentist, and over 200 general dentists in Onondaga County. If I'm on Medicare, I can go to medicare.gov/care-compare and find and compare providers, hospitals, and facilities on there. Now, we talk to our members and say you have to understand providers can join or leave an insurance carrier network anytime during the year, or your plan can also change the providers in the network anytime. If this happens, you usually will not be able to change plans. So you want to make sure your doctors are in there. That's very important. At this time last year, when you were doing this presentation, there was an issue. Thankfully, it was resolved. Family Care Medical Group, one of the largest physician groups in upstate New York, and Excellus were having a disagreement. Everything was resolved, which was wonderful. As an example, for our networks, Family Care and their partner Salt City Senior Care Advantage are hosting a Medicare open house next week. For their thousands of patients. This is something I haven't seen done, but many people have come from that employer situation where they used to have open houses and the carriers would come and hand out nice gifts and such and talk to people about their different plans. That's being done, I think, Friday the 28th at the Embassy Suites next to Destiny. And they're going to invite in different carriers to talk to their members. Aetna, Humana, United, WellCare is my understanding. So that's one way people can go and find informally a way to get information. But because of the changes, Taylor's already alluded to that earlier, questions about dental, vision, premium B reimbursements or reductions. There's a lot to go over this year that I haven't seen before. I definitely would want people to talk to an advisor or a specialist such as these two.
Wonderful. Thank you, Dan, for getting us in there. And that's how you can find a doctor. What about the drug coverage? I know that's a real key element for everybody. Tim, walk us through that. How do you know if all your medicines are covered?
Yeah, very, very important. The formularies can tend to vary from carrier to carrier. To see if your drug is indeed covered, what the tier is, so what the cost will be, and are there any requirements involved? A lot of this information is found online, but you can always ask someone like myself or Taylor to help out and look them up and help you and understand what your costs will be throughout the year. What is so, I don't know, maybe surprising for people is when all of a sudden mid-year, the cost of their medications increase and it doesn't seem understandable. Well, it's because in all likelihood, they've entered what's called the coverage gap, also referred to as the donut hole. And I'm just going to give a little bit of an explanation on this. Once the cost of your medications, if you have some expensive medications, exceeds $4,660 in a year's time, you no longer pay a flat copay or a typical co-insurance. You've now moved into this gap, and now you're going to pay 25% of the negotiated price for the generics or the name brands that you may be taking. If you go all the way through the gap, the plan steps back in and pays 95%. January 1st comes around, it starts all over again. So I can't tell you how many people say, what happened?
Yeah.
And I say, well, do you remember me talking about this? And so what they might want to do is have another conversation with their doctor. Isn't this indeed the correct medication? Maybe a patent expired, maybe there's a generic available. You got to have those conversations and see if there's any free samples on the back shelf.
Thank you, Tim, for touching on that very important element of the medicine. So, and just a reminder to our guests today, if you have a question that can be answered as we go along, or maybe at the end, if you go to the bottom of your Zoom screen, you can type your question in the Q&A box, in the Q&A field, and we will get to them at the end, or Ryan will get to it as we go along. So that's just a reminder. And as we finish up this section, Taylor, where do you begin? We talked about AEP. It seems like it's sign-up time. How do you get started with Medicare? How do you enroll for the first time?
Yeah, so a very popular question. There's a couple of different ways that somebody might get started with Medicare. First, there's your initial enrollment period when you're first turning 65. You might have a special enrollment period, such as, you're retiring, you lose your employer coverage, or you might have missed an enrollment period and you enrolled during the general enrollment period. But if you're brand new, no matter what, the only way to sign up for Medicare Part A and B is through Social Security Administration. And you can do that in person, over the phone, online. You can mail your application into your local Social Security office. If you are collecting Social Security at the time of turning 65 or receiving railroad retirement benefits, you'll automatically be enrolled into Medicare Part A and B. You'll receive your red, white, and blue card 3 months ahead of time if you are collecting. But if you're not collecting railroad or Social Security benefits, then you have to actively enroll yourself. And again, that process is through Social Security Administration.
Thank you, Taylor. Now we're going to go into that a little bit more deeply, how to navigate AEP, the election period, and open enrollment. So Tim, remind us again, what is AEP? How long does it last? When does coverage begin?
Sure. AEP obviously is the annual election period. It's from October 15th through December 7th. And whatever plan you choose will begin January 1st. So if you want to add coverage, you want to drop coverage, you want to switch coverage, the last plan you choose, you settle on, will begin January 1st. I met a woman this morning. She's been on Medicare for 7 or 8 years, but she hasn't had any other coverage. And so this was her opportunity to sign up. January 1st comes, now you have what's called a Medicare Advantage open enrollment period. That goes until March 31st, where you can switch your Medicare Advantage plan. You can go back to original Medicare, pick up a supplement. And if you do it in January, it takes effect February 1st. If you do it in February, it takes effect March 1st, and so on.
Okay. So Taylor, why is AEP a good time to shop for a new plan? Tim started to talk a little bit about that.
Yeah. So annual enrollment period's the best time to shop for a new plan, really, because that's when all of the plans can and they do change their offerings. They change their formularies, which means, you know, they're changing the cost to their medications, tiering. All of those formularies can change. Our health status can most certainly change. The doctors that we go to can continue participating or no longer participate with certain insurance companies. So it's really that time to review your current needs, review your coverage, and take a look at, does this work for where I currently am? Is it meeting my current needs?
It seems like it's a great time then to review, as you mentioned, your health. Has your health changed? It just makes so much sense. Take a little review on how you're feeling and what all your doctor's appointments have been about, and then make a better plan for the future. Thanks, Taylor. Dan, what if you choose the wrong plan? Oh my gosh, it feels like there's a lot of pressure involved here. Can you explain further the windows of time when you can zig or zag or change?
Yeah, well, once this annual enrollment period ends that we've been discussing on December 7th, we have 3 to 4 weeks off. Now the government created the general enrollment period that runs January 1st through March 31st that Tim just referenced. If you have Part A coverage and you get Part B for the first time during this period, you can also join a Medicare Advantage plan. Examples of that could be we've run into, in our case, an individual is on COBRA and now realizes they're not eligible for a special enrollment period to sign up for Medicare when the COBRA ended. And thus they would be subject to a penalty and have no coverage possibly for a period of time. The same holds true if you're coming off a New York State Marketplace plan. Another individual came to us, they just received a non-credible coverage letter that just went out this past week by October 15th. That comes from their employer, and their employer lets them know if they have credible or non-credible prescription coverage. It's very important. Generally, just groups over 100 employees would have potentially non-credible coverage. In that case, they have to move to either another plan with the employer or get on to Medicare as soon as possible. You don't want to have non-credible coverage and be age 65 or older.
So just let me stop you there, Dan. Non-credible means what it means. It means your coverage that you have had for years and years and years isn't any good anymore?
If I have an employee, I'm working at a business, they offer me coverage. That prescription coverage has to be as good or better than what Medicare offers. And if it's not, it's deemed non-credible. There are very few plans like that, but we have some major employers that offer only generic prescription coverage to bring down the cost and make it more affordable for their employees. If that's the case, I don't want to be 65 or older and on a plan that has non-credible coverage. So those letters that have been received in the last few weeks are very important that people pay attention to those. And if it does say non-credible at the top, you start asking questions. Go to your human resource person, reach out to a specialist, as we've said before. Another situation that just arose was an employer had lost employees during COVID. For years, they were running about 25 employees, but now they're down to 18. And as we're reviewing things, that, oh, we've got to get a hold of your employees that are 65, or if they have a spouse who's 65 or older, and notify them that your coverage is no longer primary. You have to get onto Medicare. So there are different things that can happen during a year or to a person's personal situation where they may have to look to get on during this annual enrollment period, January through March.
Thank you, Dan. That was really informative.
Okay.
Thank you. Tim, lots of talk about getting paid for being healthy. You know, does Medicare have any plan that commends our good health? Does that work into the Medicare world like it does in some other insurance plans that people might have had pre-65?
Sure. Well, we do have zero premium Medicare Advantage plans, which is, certainly nice for someone that's rather healthy and not going to the doctor frequently and really doesn't want to have to pay more than they have to. But we also have what are called Part B give back plans that also still have a zero premium, but will actually pay the member a monthly amount, reducing their Part B premium. We offer a plan that has a $42 a month give back. So your $164.90 for Part B gets reduced to $122.90. And hey, that's some extra money in the pocket because you're kind of healthy. You don't go to the doctor a lot. You don't mind a slightly higher copay if you're not really needing to use it. So this has become popular. It's coming up in our seminars. It's coming up over the phone. There's a lot of interest, and we're kind of excited to be able to offer such a plan.
And that's a plan that Excellus is offering. And I would assume the other private insurers are offering similar plans like that. How do you navigate, Taylor, your clients when something seems like a really good fit for them? How do you navigate them when they come asking you that question?
Yeah, and that's definitely a common question of, I saw this commercial, or my friend has this, my spouse has this, I want it too. And it's not always that simple. And if you've worked with me before, I'll say that to you. And it's really about what works for you and what medications are you on, what doctors do you go to, do your doctors accept that plan, and really just taking a look at your personal situation and whether it is with Excellus or Humana, United Healthcare. There's options that work for every individual person.
Great, thank you. We are doing great on time. This final section focuses on what's new for 2023, which sounds odd to even say it. 2023. Taylor, let's start with you. The Inflation Reduction Act, how did that impact Medicare?
Yeah, the Inflation Reduction Act, new law from August 2022, that will begin taking place in January 2023, which has a couple of different aspects to it. But in terms of health insurance and the Medicare population, the main focus and goal is to help those on Medicare save money by improving the access to affordable treatments. Specifically, a main goal is looking at Part D insulin medications, and starting in January they'll be putting a $35 cap for each 1 month supply of insulin. So that will help save thousands of dollars for so many people. And we know just specifically on individuals on original Medicare, there's 3 million people on original Medicare who need to use some form of insulin. So it'll help a great chunk of that population. Individuals will no longer have to meet a deductible. And then in terms of getting coverage for their insulin, and then individuals will also have coverage and flexibility come 2024, 2025 to have an overall cap of $2,000 on their out-of-pocket prescription drug costs. And also Medicare is going to now be able to kind of put some penalties on the pharmaceutical companies and make them pay rebates to Medicare if they start to increase the rate of their drugs higher than the rate of inflation. So all good things. And I would say the last main point of it for our Medicare population is that for the Part D prescription, Part D plans, individuals will no longer have to pay any out-of-pocket costs for vaccines such as your shingles and your tetanus are the main ones that you might see that with. But all exciting things coming down the line for sure.
It makes a lot of sense. Are there often changes like this many changes in Medicare? Or are those the ones you listed all were because of the Inflation Reduction Act?
All of that is just specifically within the Inflation Reduction Act that went into, was signed in August.
Okay, great. Thanks, Taylor. Dan, up next, how are Part B premiums changing for 2023? Can you review what the Part B premiums really are and then tell us how they're changing?
Actually shocking. The Part B standard monthly premium for Medicare Part B enrollees will be $164.90 starting January 1st. Tim stated that earlier. It's a decrease of $5.20 per month from the current $170.10. As a reference, a year ago, when you were speaking, it was $148.50 in 2021. And in 2020, it was $144.60. I think people got used to it costing in the $140 range. So there was a bit of a spike last year, close to 15%. People asked, why did that happen? Based on government statistics, they said prescription costs were a major driving factor. In particular, the cost of a new Alzheimer's drug that was coming to the market. I believe it's pronounced Aduhelm. And this Alzheimer drug could be widely utilized. The issue was it's about $28,000 per year for that drug. There are many other drugs that are several $1,000s a month as well. But Medicare limited coverage to patients enrolled in any trial or study approved by the FDA or the National Institute of Health. So that full cost didn't come into play, and thus they were able to reduce the cost a little bit this year because they had a reserve, and they can't have a reserve legally. So we're going to get a break for the next year, which is nice. So we're going to be going from 170 down to 164.90. There is a small segment of the population, unfortunately. CMS estimates about 7% of the people who are on Part B will be paying more than the $164. And it's based upon income, and they use your tax return from 2 years ago. So they'll be using your 2021 tax year, and they call it a modified adjusted gross income. If I file single tax return, and my income is over $97,000 in 2021, my cost will go from the $164 up to $230, and it will continue to grow at different levels up to $560 a month. If I file a joint tax return, once our income exceeds $194,000, again, based on 2021, then my cost will go up. Again, it's less than 10% of the population, but I just want to mention that because it is based upon your income, the cost of Medicare Part B.
Okay, that makes sense. Thank you. Thank you, Dan. Tim, what are some of the trends that you're seeing for 2023 and new plans that'll be available through your employer as well, Excellus?
Sure. Well, there's definitely the trend of the give back. A lot of people want to have comprehensive dental coverage, preventive dental coverage. People are looking at, is there an over-the-counter benefit? Maybe I take something for allergies, and it would be great if my plan covered it. People are looking at gym memberships. Does my plan cover a benefit at the gym? For example, with Excellus, a membership at a participating gym has no annual charge. It's obvious that we're trying to encourage people to stay active and be healthy. At Excellus, we have come up with a new plan called the Medicare Blue Salute. It's kind of geared towards someone who might already have prescription coverage, usually the VA, someone that's using the VA. This is also a zero premium plan with a give back to reduce that Part B premium, $35 a month. So now the veteran is actually getting money back in his or her check. And they're also getting the extras, like I mentioned before, the dental and eyewear allowance, the gym, the over-the-counter benefit. And it also covers them anywhere in the world. With Excellus, our Medicare plans cover urgent care and emergencies worldwide. Another trend is offering members a flex card to use the way they want. We have the Medicare Blue Flex plan that gives a $500 flex card to pay for hearing or vision or dental costs. And some of that's already built in. So this is on top of that. So if I'm needing an expensive pair of glasses and the plan already covers $200, and now I take this $500 flex card, I can get that $700 pair of glasses at basically no extra cost. So a lot of exciting things. Our plans just seem to be getting better and better each year, and that's certainly helps make my job easier. So we're proud of what we do here.
It seems like the Medicare and Medicare Advantage private plans are reacting to the healthy group that we have in this older population, you know, and the need for dental and the need for healthy benefits as well. So it's really a round robin here. Trends for 2023, Tim, we just got your thoughts on that. Taylor, what trends are you seeing in your office?
Yeah, I think I could definitely echo some of the information Tim was just talking about. Individuals looking for really anything in that give back or those cost saving options. So individuals looking for, of course, if they are younger, healthier, not seeing a lot of doctors, not a lot of medications, looking for those lower premiums, whether it's with Excellus or another insurance company. Just looking for ways to save money and just asking for their general, I need to review my plan. I watched you guys in the spring, or I watched you guys last fall. I know I need to review my plan again. So a lot of good things coming down the line from and a lot of reaction to, I would say, the last couple of years, and listening to some of our cries.
Yeah. Well, and review every year. Dan, what are the trends you're seeing in your office? Because you have a different perspective here.
Well, in the group business, when we work with organizations, not-for-profits or companies, we've always been able to offer a number of products with various benefits. And I believe we're finally seeing that here in the Medicare field. There's so many things that seem newer. There's more to review. This is the time where people are getting more for less, in a sense. Take advantage of it, but make sure you talk to someone who understands what all these benefits are so they can properly explain them. Tim and Taylor have already gone over a number of them. There's the premium reduction that's monthly, which is wonderful. There's the dental. Now there are questions about network, out of network, what's the reimbursement to the dentist? All those are important questions. Vision, hearing aids. I don't think people have ever gotten more for this amount of money. So the seniors should be very happy with what the options available are. Just as we said, make sure you're looking at everything, especially prescriptions. Are you paying a dollar amount versus a percentage? So you could sit down with these experts and they can go over the prescription to tell you which of the 5 tiers they may be in and whether it's a dollar amount or percentage. Those are critical factors in deciding which plan.
We have some questions coming in. We have a few more main questions for our panelists, but a reminder to everybody, we will be getting to your questions here as well. So as we wrap up the last couple questions here, panel, best advice for those who are shopping during this annual election period, this enrollment period. Who wants to go first? Taylor?
Sure. I think my biggest approach this year is we get those books every fall, Medicare and You, and I've really started framing my work and my presentations on it's not Medicare for you, it's Medicare for me, and really remembering that it is that individual approach. Even when you're married, your best friend, your neighbor, just because a plan works for the closest, most dearest person in your life doesn't mean it works for you, because we all have different needs, different health status, doctors, all of that. So really my best advice is assess, work with someone who understands the field, and it's complicated, it's overwhelming, there's a lot of information, and just, take that step by step to really figure out what works best for you.
We're used to getting the family plan, those kind of things, but for Medicare, it is all about me, right?
Yeah.
What's best for you. Okay, thank you. Best advice for those shopping, Tim?
Well, like Taylor said, take your time making this decision. No knee-jerk reactions. You've got some time. You've got till the second or the first week of December. And just because it works for your brother or your cousin doesn't mean that's the way for you to go too. You want to obviously take a look at cost. That's way up there. Talk to your doctor, talk to their staff. Who do they appreciate working with? Who's paying their claims quickly? Who's not giving them a hassle or putting up walls just to get your benefits paid? Obviously, you're getting inundated in the mailbox, watching television, but just take a deep breath and realize that there is an ideal option out there for you. Just talk to somebody and get everything off your mind, and then you'll have that peace of mind that you've chosen the best plan for you.
Great, thank you, Dan. Tim, Dan, do you have thoughts about best shopping advice?
As I said, this is a plan about you. You can have a spouse and they can be on a completely different plan, as we've discussed. That's very important. You pick the plan that's specific towards your needs. The other thing I mentioned during a previous session in this one is I really like this book. It's hard to see it, but it's Medicare and You for 2022. You can get it off their website. You can order it, it's delivered to you. It's a great resource. It just covers the basics and makes you feel a little more comfortable that I know some of the answers. And then I feel like I should sit down with a specialist and go over everything in detail. That's very important that people just feel comfortable and they make sure that they are getting the proper answers to their question. And you can only get that from a specialist. And there are so many options now that weren't available just a few years ago. You want those thoroughly explained, and you want to make sure you understand those benefits plus the limitations.
Dan, you're holding that up. I feel like it's like we need to prepare for not the exam, but prepare for the meeting. We need to get someone's advice. There's a lot of info out there. Certainly, to be prepared for the meeting, we need to read that pamphlet that you suggested, or go online and poke around different private insurers' websites, also Medicare.gov, and have some kind of general knowledge before you walk into that meeting, so you're not just totally blindsided. And if you're watching this webinar, this is one of these informational resources as well. So this is great. We talked a bit in the last answer there about cost savings. Tim, I think you mentioned it. So Taylor, could you discuss some specific cost saving tips? Even if we've mentioned a few before, let's get into them, because I know that we see some questions about them coming up on our screens.
Yeah, absolutely. So I know, and Tim had mentioned, if you're on prescriptions and that's, so it's middle way of the year, you're having some issues. First thing you can always do, talk to your doctor. Can I switch to a generic? Is a generic an option for me? Does the doctor have samples? But then there's also programs here in New York State and at the federal level that can help you towards your prescription drug costs. Each of these are based off of income at different levels. So the first is the Extra Help program through Social Security Administration. This program can help get you up to, it's $4,999, I believe, to be exact, of coverage towards paying for prescription medications. And again, it is based off your income as well as your assets. For example, single individual for 2022, if your monthly income is below $1,719, with asset limits below $15,510, you would qualify for that Extra Help program. Then there's the Medicare Savings Program. Medicare Savings Program is run, it's through New York State Medicaid, but it's run at the county individual level. Helps pay for Part B premiums, can help with Medicare Part A as well if you are having costs associated with Medicare Part A, and that is something that I can always mail the application to you. Any of these programs, I can help you do a screening for them. You can always give me a call or email me and I can mail you any of these applications. And then the last is the EPIC program. EPIC is the New York State Elder Pharmaceutical Insurance Coverage. You must have a Medicare Part D plan. You must be over the age of 65. And this is also based on income for an individual. You must have a yearly income below $75,000 per year. And that's something EPIC you can apply to at any point of the year as well. And you mail the application into their office in Albany, and they usually respond to it in about 2 weeks. There's no cost to be in any of these programs. With the EPIC program, you might have to meet a deductible. It really is based off of your income, and call me at any time. I'll help screen you for those and get those applications to you if needed.
And a reminder, we'll have contact information for all of our panelists that on a screen that will come up at the end. I had it up at the beginning, and we want you to reach out to them. They are a wealth of information. Thanks, Taylor. Now, we've gone through the basic questions, and we have a slew of questions from our guests, and I really, really appreciate it. We'll fire through as many as we can. I mean, we probably have at least a dozen questions, gang, and we have time to answer them. So the first one I have is, can you go into a bit more detail on the differences in plan choices, specifically like HMOs, PPOs, HMO POSs? I mean, we haven't really talked about that yet today. How does that fit into all of this? Who would like to take that question?
I could take it.
Tim, thank you.
So yeah, a PPO is a preferred provider organization. It's preferred that you see doctors that are in network to keep your costs down, but you can also see doctors that are out of network. An HMO, a health maintenance organization, is really designed to help people keep their costs down as long as they stay in a smaller network of physicians and facilities. The POS, the point of service attached with some of these HMO plans, can allow you to have some benefit in another state outside of the area. And then there's private fee for service, PFFS. Really, there isn't a contract between the insurer and the facility, but the insurer will pay as long as the facility accepts their payment. So that can be a little unnerving if there isn't a contract. But at Excellus, we have contracts. So if they participate, they're going to accept your insurance.
Okay. So I'm looking at our next question. Thank you, Tim. Our next question, I think this is going to go to you, Taylor, because it's a kind of an add-on, a follow-up to what you were just talking about, Epic. How does Epic interface with Part D prescription plan? Is Epic primary? A lot of concerns about, Part D, the medicine.
Yeah. So Epic isn't it's not a plan. Epic is a supplement, helps to supplement out-of-pocket costs, helps lower your co-pays, but it won't ever be a primary plan. Epic will be a supplement. Epic's kind of like the Medigap plan. Medigap's for your Part A and B. Epic is for just your Part D drug plans.
So it's like an add-on to the drug plan.
Kind of, yes.
I oversimplified. I'm so sorry. Which is why we have these every. Go ahead.
One more thing about Epic, which is unique, is it gives someone a SEP or a special election period where they can change their coverage at any point throughout the year, once a year. So that's like an ace up the sleeve. If my health does a complete somersault and I want to reassess in the middle of July, I have Epic. I can make something happen as soon as August.
All righty. Dan, this one's for you. We may have touched on it before, but do I have to apply for Medicare?
No, if I'm actively working and the employer has 20 or more employees, I can stay on that employer plan until I decide to retire, at which time that creates a special open enrollment where I can then enroll in Medicare without a penalty.
Okay.
But it's very important that I understand how many employees are where I work. And that's something you should talk to your human resource person, because I may work in an office and think that's the total number of employees, but we could have other employees through common ownership that I'm unfamiliar with. And there may be tax documents that are filed or forms that are filed with our insurance carrier. Each year they require us to update that and determine, do we have more than 20 employees? Do we have more than 100 for Medicare disability? Those are important questions. Get clarification from your employer on how many employees there are.
So that's appropriate for me to go to my HR person and ask these questions.
Absolutely. You want to have the right number, so you don't want to be in a situation where I thought we had over 20 employees, we only had 18, and thus my insurance that I'm counting on is no longer primary. They don't have to pay the claims. I said, that's Medicare's responsibility. You should have joined Medicare.
Okay, got it. Really important. Thank you, Dan. This next question is coming in. It's asking about Medicare Advantage, which we learned is the private insurer element. How does a Medicare Advantage plan work if traveling to other areas of the country on vacation, snowbirding, etc.? How can we be assured of a provider network, and how do we find out about that network? We've touched on all of this again, but the question obviously is coming up a lot from our viewers today. Who would like to grab that one?
I think I'll grab that one.
Thank you.
Just because Excellus, we have a travel program. If you get one of our Medicare plans, on the bottom of the ID card, there will be a suitcase, and that means that your plan travels. So let's suppose I am a snowbird and I'm going down to Florida for the winter, and my knee's been bothering me and I want to do some rehab on the beach in the sand. I can do that and be in network because we're connected with Florida Blue. So as long as my surgeon is participating with Florida Blue, my Excellus BlueCross BlueShield will be accepted. What else were you asking?
Well, so that answers it. And let me just remind our viewers, that would be the private Medicare Advantage for Excellus BlueCross BlueShield, our presenter today, but also for other private insurers might have this kind of travel.
They might.
They might have it. They may. I don't want to. And then the other part of the question was, how can we be assured of a provider that's in network? And how do we find out about that network? It kind of goes back to that beginning question, Dan, where do I begin? How do I find the doctors? So
Well,
Tim,
you should be looking at the company's website and looking for participating providers. If you're going to be traveling, there's not a problem with finding that zip code in Florida where you'll be visiting for a few weeks on vacation and just looking for providers ahead of time. At the very least, understand where there's a hospital, an emergency room, an urgent care facility close by to where you're staying. And that way you're assured that they're in network ahead of time, a little research ahead of time.
To find a participating facility or doctor throughout the country, maybe you are with Excellus. Here's the link to do so. It's provider.bcbs.com. They'll ask for your prefix. The prefix is VFM.
okay.
Or you just
ahead.
ask me to look them up. I'll look them up.
Get the helpers. Taylor, I think this next question is for you. Who should select a supplement instead of an advantage plan? So I think we're back to that earlier graphic that I need to look at every 6 months and figure it out, right? You have the Medicare Advantage is your private stuff, your original Medicare, and then you have these supplemental things that you can add on to with the original Medicare. Can you review that again? How do you know who should pick what, and how do you know which one to pick?
Right. So somebody who is, you're considerably healthy, you're not taking a lot of medications, you're not going to a specialist that often, you want lower costs, or maybe you need those lower costs. That would be someone who's more than likely going to look at an advantage plan. Original Medicare, you have your Part A and B, you have your standalone prescription drug plan, and then you have the option to add on those Medigap supplement plans. The Medigap supplement plan will be good for somebody who is seeing a lot of specialists, going to a lot of doctor's appointments. Specifically, you might see somebody who's on chemo, who I get a lot of referrals from individuals who are on dialysis, who, you're going to a lot of appointments, you have a lot of out-of-pocket Medicare Part A hospital and Part B medical costs. So, Medigap supplements can cost you more upfront, more in premiums each month, but they help to save you on what I refer to as a surprise cost. So you're not having that add up of copay, co-insurance, because you're just paying everything up front with a Medigap supplement.
Thank you, Taylor. This next one is, I think we touched on, but I don't want to ignore it. We are getting a lot of questions about, is income a factor at all in qualifying for Medicare? Maybe that's back to you, Taylor.
So it's not income isn't a factor for qualifying for Medicare. Medicare is based on your age, or if you're younger than 65, end-stage renal disease or ALS. Income impacts, as Dan had mentioned earlier, it can impact your monthly Part B premium. If your income is over a certain threshold, between certain thresholds, you'll pay more or less, or you'll be at that standard Part B premium, which for 2022 is the 170.10.
So again, we need to ask the experts. Thank you, Taylor. This next question is interesting. I have a PPO, says our guest, through Empire BC from my employer, and it's a really good plan that includes prescription coverage. Should I still pick up a Part D? Is that a question for you, Dan?
They have the Empire plan. I don't know if they're a retiree, they're actively working. They would need to sit down with someone and bring the plan details and establish what their status is with that employer and how they obtain that plan. And then we can make a comparison, or Tim or Taylor would, with a Medicare Advantage plan or Medicare supplement. But the way the question's phrased to me, I don't feel I have enough information to give that person an answer.
If they need to add on to Part D or not.
You need clarification.
Okay. Great, thank you. This one is for you, Tim. Can my spouse and I have different Medicare plans? I mean, we've answered it, but it really bears repeating if you could.
100%. The needs could be different between the spouse. Prescription needs could be different. The utilization, the frequency of needing care could be different. One spouse might go to the doctor once a year. The other might go to the doctor once a month. So those are all key considerations. And in Medicare, everything's individualized. There's no family coverage. So each person does what's best for themselves.
Just a little time check for everyone. We have about 8 more minutes, which is a great amount of time. And we have shall we say, oodles more of questions. There's at least a dozen more questions. So I'm just going down the line because these are great questions. Thank you to our audience and to our panelists. Next up we have, and I'm thinking this is a follow-up for you, Dan. Does Medicare Part B annual costs change with annual income, or is it fixed at higher amounts? And they say in their question to you that it's a follow-up to your comment. So
Well, my understanding is the Part B premium cost to you will be dictated upon what your income reported to the IRS was from 2 years prior. So my current premium is based upon 2020's income. Next year's will be based upon my 2021 tax return. And that'll dictate what my Part B cost will be.
okay, thank you, Dan. Tim, this is for you. How much is coverage G at Excellus? I'm not sure I can handle another alphabet letter. What's G?
We do have a supplement plan G. It's rather popular. It's $203 a month. Now, that's a lot more than $0 a month, isn't it? But if I'm going to the doctor, I want that peace of mind of knowing that I'm covered. 203 is not so bad.
Okay, and so that's something that you're, again, for our viewers, again, this is something that is offered by a private insurer, Excellus, and
Right, we're backing up Medicare.
okay, it's like a backup. Okay, thank you.
To tag on to that, Tim, when we're talking about a husband-wife, one can be on a Medicare supplement and the other could be on a Medicare Advantage plan, depending upon their needs as well.
Yes,
Okay.
correct.
All righty, so Dan, the pamphlet that you held up, lots of questions. Can you reiterate, please, the name of the book, where people can get it? Lots of questions about that. Is that a private pamphlet from someone, or is it from the Medicare.gov? Who's the? You need some
CMS,
deets.
Medicare.gov.
Okay,
Well, it doesn't come in that great, but that's what it looks like. It's at least
What does
a
it-
half-inch thick, if not more, but you
What's-
can also get it online. Oh, here, Taylor has a better picture of it.
and hers says 2023. So Medicare and you, remember everyone, this is where Taylor was mentioning that it's Medicare and you, but it's really Medicare and me. Let's focus
Medicare
on
for
me. Yeah,
Well,
it's about, yeah.
I just don't want to be selfish, so I say Medicare and you. But it's in a sense a Medicare Bible. It does a great job introducing Medicare Parts A and B, Medicare Advantage plans, and explains things in a very good terms. So a lot of people, I believe, could read it and get a somewhat a comfortable understanding. And this is just a starting point. Now take this information and talk to a specialist.
So this is out by Medicare.gov. So it's not a private insurer, it's the Medicare.gov kind of workbook, if I may be so bold as to say, right? So if people can go online and order one maybe, or go to the library and find one.
You can go on the CMS website, Center for Medicare Services, but Medicare.gov, it's actually called the official US government Medicare handbook. The government actually publishes it.
And I will add as well that I get a bulk amount of those books at my office through the high cap program, which I counsel through the New York State Office for Aging. So if anybody needs them, I have plenty in my office. I can mail them to you if you don't have one already.
Okay.
They're
Thank
a great
you.
resource.
Yeah, it's the workbook, right? It's a good starting place for everybody, and you can draw on it, circle it. Husband, wife, father, right? You can figure it all out. Okay, tons more, and highlight it in all different colors. 356, 355. We do have many more questions here, so let me just figure out the timing here. 355. All right, we've knocked that question out. This one, Dan, is for you. If I choose to stay with my company plan, but I'm turning 65, do I still need to sign up for Medicare so I don't incur a penalty? So you've answered that, but I'm not sure we talked about the penalty.
No, as long as I have qualified coverage, I will not face a penalty when I decide to leave. Yeah, as long as my prescription coverage is credible, which a large majority of people, they're fine. If I decide to continue to work, many people are working until they're 70 to maximize their Social Security benefits. They're fine at age 70 to retire. And at that point, go on to Medicare Parts A, B, and look at a Medicare Advantage plan or a supplement plan at that point. There is not a penalty.
Okay, thank you. Here's a scenario that a lot of our guests have been faced with. So this is just one version of a similar scenario. Medicare Advantage plan may choose to deny coverage for something my physician has ordered. That would be otherwise be paid for by straight Medicare. For example, not authorizing rehab days even though they were ordered by my physician. Can you confirm? What can you do there? I didn't really, that's exactly how it's written, but let's try to decipher what that question really is. What happens if your doctor says, yeah, you need this, but Medicare is not going to pay for it?
So typically the rule with Medicare is if it's medically necessary, it's going to be covered. I have heard things where someone was adamant that original Medicare would have covered something, but the Medicare Advantage wouldn't. And I don't know how that's possible because we have to follow Medicare guidelines 100%. If something is not immediately approved, it could be actually a cry for additional information to help understand the need behind it.
Okay, great, thank you. Here's the next question. I'm under 65, retired, and using my ex-employer's retiree medical coverage. Turning 65 in mid-2023. Is this considered a life event for changing plans, or rather, is this considered a life event for changing plans?
Well, it gives you your initial election period, so you're new to Medicare, so that's your 7-month window.
Okay.
Because you're turning 65, whether you keep your retiree benefits or not, usually comes down to cost.
Okay, I think we have time for, well,
I think that was
Go ahead, Dan.
that was the first time the 7 months has been mentioned, just so the viewers understand. It's 3 months prior to your birth month, the month of your birth, and the 3 months after. But if I was born in October, October 1st is when I would start Medicare, the first of that month.
All right, I think this is our last question, and we need to answer it as swiftly as possible, maybe. Is if your health, can you talk a little bit more about the medication gap? I'm trying to understand my father's varying prices for his diabetes medications. We talked about that little gap in there, Tim, and we only have about a half a minute left.
So once the negotiated price of my medications exceeds $4,660, excuse me, I've gone into that gap. I'm going to spend another $2,300 to get out of that gap. So to pinpoint every penny, every dollar, it's very difficult, but to wrap your arms around it, expect to spend about $2,200, $2,300 to get out of that gap, unless you have a program like Epic.
All righty, still so many more questions firing in. Thanks to our audience for listening and the questions. Remember, this will be recorded, so when you get the thank you note, you can go on to Excellus's website or to Syracuse.com, see this whole recording and see the Q&A side as well and understand the answers. You can always contact our fabulous panelists here, who I'm so appreciative. Thank you for joining us, Tim Shadle, Dan Goetzmann, and Taylor Frawley, and thanks to everybody for watching. Feel free again to reach out to any of these panelists. There's their information. Special thank you again to our sponsor, Excellus BlueCross BlueShield. And a reminder again, it's all recorded. Look for the recording in the thank you note. You can always go to Excellus BlueCross BlueShield's website and Syracuse.com in the coming days to learn more. Thanks everybody for joining us. Have a great afternoon, and we're so thankful that you joined us during this Guide to Medicare. Be well, everybody.